Hello friends, in this video now I'm going to take very important topic of lipoproteins, that is all the HDL, LDL, VLDL we'll be doing in this topic. And now in this topic when they ask you questions, they will try to confuse you between lipid and lipoprotein. Let's be very clear from the very starting. Lipids means all that we have done in lipid chemistry like triglyceride, phospholipid, cholesterol, that is lipid. But lipoprotein is HDL, LDL, VLDL, right? Now, why this lipoprotein topic is important? Because it is a form of lipid transport. It is a form of lipid transport because lipids are non-polar and blood is polar. So, there is a problem how this polarity non-polarity issue is taken care in body. So, this is a problem of polarity non-polarity. We have to see how body has solved this problem, right? So, see here, body is very smart. What body will do? Body will put all the lipids in the core. Lipids in the core, and the periphery of this structure is made up of proteins, and this kind of structure where proteins are on the outside, polar portion is outside, this kind of structure can easily move in blood vessels, right? And this structure is known as lipoprotein, right? Now, which lipids are present in lipoprotein? Let's see. Lipids present in lipoprotein are, one is triglycerides are present. You know triglycerides are totally non-polar. There are 3 fatty acids and 1 glycerol, so totally non-polar. Then phospholipids. Phospholipids are amphipathic. Phospho means polar portion, lipid means non-polar portion, right? Then cholesterol. Cholesterol also I told you it is amphipathic because it is having one OH group. So because of OH group it is polar. But otherwise it has sterol ring, because of that it is non-polar. And there is one more thing known as cholesterol ester. Cholesterol ester is equal to cholesterol plus fatty acid. So it's kind of alcohol cholesterol plus fatty acid. So ester bond will be formed, and this is known as cholesterol ester, which is totally non-polar, right? Now in the structure of lipoprotein, how these lipids are arranged very smartly. If some lipid is totally non-polar, that is triglyceride and cholesterol ester, totally non-polar, so that is totally hidden in the core. But if some lipid is amphipathic, then its non-polar portion will be towards inside, its polar portion will be towards outside. So this way amphipathic lipid will be present in the structure of a lipoprotein, and 2 amphipathic lipids which are present are cholesterol and phospholipid. Let's see how they are arranged. See, cholesterol will be present like this. Ol is polar portion towards outside and the lipid portion towards inside. And phospholipid will be present like this. Lipid portion towards inside, phospho is the polar portion that will be towards outside, right? So, this is the structure of lipoprotein. I have made it very easy. Now, one table we will be making. Now, see this table. First column is lipoprotein. Which lipoprotein? Then which lipid, which protein it contains. This table we will be doing, and I will be taking lipoproteins in a sequence. First we take chylomicron, then its remnant, chylomicron remnant, then we will be taking VLDL, and then its remnant, VLDL remnant, also known as IDL, that is intermediate density lipoprotein. Then next is LDL, low density lipoprotein, then 6th is HDL, high density lipoprotein. Actually, the sequence why I am taking, because this sequence is very important and very helpful in solving many questions. Actually, density is increasing in this sequence, so it is very clear that HDL has high density, that's why known as high density lipoprotein. But chylomicron has least density. Now, there are 2 formulas for density. Density is inversely proportional to size of lipoprotein. Density is inversely proportional to triglyceride content. Now, HDL has maximum density, so it will be smallest in size and it will be having least triglyceride content, and chylomicron will be largest in size and having maximum triglyceride content. There is one more formula. Density is directly proportional to percentage of proteins here. So, maximum proteins will be present in HDL and minimum proteins will be present in chylomicron. You can use these 3 formulas to solve so many questions. You can easily tell the ascending descending order of these properties in case of lipoproteins. So, many questions can be asked and you can answer all of them very easily with these 3 formulas, right? Now, let's start from the first one, that is chylomicron, and we will be starting from right. from diet, the main lipid which is coming in diet is triglycerides, exogenous triglycerides coming in diet. They will be going into the intestinal cell, and intestinal cell has to throw this non-polar triglyceride into blood, right, so that this exogenous triglyceride can be given to full body. But there is a problem that triglyceride is totally non-polar and blood is polar. Therefore, intestinal cell is unable to throw this exogenous triglyceride, non-polar triglyceride into polar blood. So, intestinal cell has to do some modification. So, what intestinal cell will do? It will take this triglyceride, non-polar triglyceride in the core, and the periphery is made up of a protein, and that is ApoB48 protein put in the periphery of this triglyceride. Now, this structure is known as chylomicron. This way, chylomicrons can be easily transported into the blood vessel from intestinal cell. So, can I say chylomicrons transport exogenous lipids or exogenous triglycerides from intestine to peripheral tissues? So, the lipid of chylomicron is triglyceride and protein is ApoB48, which is synthesized in intestinal cell, right? Now, in circulation, chylomicrons are moving in circulation. They will keep giving this triglyceride, exogenous triglyceride to the body cells, and finally, they become smaller in size, known as chylomicron remnant. Now, whenever you have to write about remnant, in the lipid you have to add cholesterol, in the protein you have to add ApoE. So, chylomicron remnant contain lipids triglyceride plus cholesterol and protein ApoB48 plus ApoE. It is very easy to learn. Chylomicron is one word. So, one lipid, one protein it contains. Chylomicron remnant, two words. So, two lipids, two proteins it contains, right? Now, if in a patient they say chylomicron is increased, so you will say only triglyceride is increased, cholesterol is normal in this patient. And if you say chylomicron, if they say chylomicron remnant increase in some patient, then you will say both triglyceride and cholesterol are increased in this patient, right? Now, see the next one, VLDL. Now, liver will synthesize endogenous fat. Liver will synthesize endogenous fat, that is again mainly in the form of triglyceride. So, endogenous triglycerides are synthesized in liver. So, liver has to throw this endogenous triglyceride into blood. But again, there is a problem of polarity, non-polarity. You can see here, I am almost going with the same story again now. So, now triglycerides cannot be thrown as such into the blood. So, liver cell now has to modify these triglycerides. So, liver cell will take triglyceride, endogenous triglyceride, will put protein in the periphery, and that is ApoB100 protein put here, and this structure is now known as VLDL. So, this way can I say VLDL transports endogenous triglyceride from liver to peripheral tissue. Chylomicron was from intestine to peripheral tissue. So, now VLDL contain which lipid? Triglyceride, and protein is ApoB48. In circulation, VLDL will be converted to VLDL remnant. VLDL remnant contain triglyceride plus cholesterol, ApoB48 plus, sorry, it's not ApoB48, it is ApoB100. So, ApoB100 plus ApoE, and now VLDL remnant will be further converted to LDL, that is that point of time when all the triglycerides are not there, only cholesterol is present in the structure. That structure is known as LDL. LDL is having proteins ApoB100 plus ApoE. And then HDL. HDL is synthesized in liver and intestine both, but mainly it is synthesized in liver, and the lipid which is present in HDL is cholesterol ester, and the protein present is ApoA, C and E. So, three proteins, you can learn it like this: ACE, mnemonic ACE, ACE. This ApoC and ApoE, they have no role in HDL. In fact, HDL will give this ApoC and ApoE to chylomicron and to VLDL. When the lipoproteins are moving in circulation, at that time HDL will give these two proteins to chylomicron and VLDL, right? Now, for the conversion of chylomicron to chylomicron remnant and for the conversion of VLDL to VLDL remnant, here one enzyme used is lipoprotein lipase. The enzyme is lipoprotein lipase. This enzyme lipoprotein lipase is activated by ApoC. ApoC is the activator of this enzyme lipoprotein lipase, right? There are two lipases present in the metabolism. One is lipoprotein lipase lipoprotein lipase is present in the blood vessels. It is present in the endothelium of blood vessels. But the other one is hormone sensitive lipase, short form HSL, hormone sensitive lipase HSL. Now, lipoprotein lipase is present in the blood vessels, but hormone sensitive lipase is present inside the cells of adipose tissue. Inside the cells of adipose tissue. Now, this lipoprotein lipase is anabolic enzyme. It helps in the storage of triglycerides in the body. It helps in the storage of triglycerides in the body. So, because it is anabolic enzyme, it will be activated by insulin. But hormone sensitive lipase, it will be inhibited by insulin. Insulin will inhibit this enzyme because it is catabolic enzyme. It will break down the triglycerides of adipose tissue during fasting or starvation, right? Now, remnants, they have ApoE on the surfaces, therefore, they can be taken up by liver. That is chylomicron remnant and VLDL remnant. They have ApoE on the surfaces. ApoE can be recognized by liver, therefore, remnants are taken up by liver. And LDL is also taken up by liver. LDL is taken up by liver. Let's say this is liver. On liver, there are special LDL receptors present. This is LDL receptor present on liver. Now, when LDL is taken up by LDL receptors on the liver, then the ligand for these receptors, the main ligand is ApoB100 and the minor ligand is ApoE. I just told you that ApoE is required for uptake by liver cells for the remnants. So, remnants have only one ligand, that is ApoE. But for LDL receptors, there are two ligands, that is ApoE also and ApoB100 also. And in fact, the main ligand is ApoB100, right? Now coming to HDL. HDL will take cholesterol from peripheral tissues and it has to give this cholesterol back to liver. When HDL will take cholesterol from peripheral tissues, then HDL will add one fatty acid to this cholesterol so that now it becomes cholesterol ester. I told you the lipid present in HDL is cholesterol ester, not cholesterol. Now this cholesterol ester is taken up by liver. Now this reaction, how cholesterol is converted to cholesterol ester is very important and the name of enzyme here is LCAT, right? So what happens here? In HDL, HDL has maximum phospholipids. Maximum phospholipids is mainly in the form of lecithin. If you remember the structure of lecithin, lecithin has two fatty acids. So we can take one fatty acid from lecithin and the structure left is known as lysolecithin and this fatty acid from lecithin is transferred to cholesterol and therefore in this reaction transfer of fatty acid is occurring. That's why the name of enzyme is LCAT. AT stands for acyl transferase because acyl fatty acid is getting transferred in this reaction from L to C. From lecithin to cholesterol, acyl is getting transferred. So, name of enzyme is LCAT, lecithin cholesterol acyl transferase. ApoA1 is the activator of this enzyme. ApoA1 is the activator of this enzyme, right? Now, also note down that HDL is known as alpha lipoprotein. HDL known as alpha lipoprotein, also known as lipoprotein capital A. VLDL is known as pre-beta lipoprotein. LDL is known as beta lipoprotein. And there is one new term, lipoprotein small a. Capital A is HDL. Lipoprotein small a is equal to LDL plus Apo small a. Now, LDL will cause atherosclerosis. So, I can say that lipoprotein small a will cause atherosclerosis because it contains LDL. But lipoprotein capital A will prevent atherosclerosis because it is nothing but HDL, right? Then coming to hyperlipoproteinemias, these are diseases where lipoproteins are getting accumulated in the blood vessels. So, this is latest Fredrickson classification. The table we have to do type 1. First is type 1. Defect is in lipoprotein lipase. Lipoprotein lipase is breaking down chylomicrons and VLDL. So, therefore, when lipoprotein lipase enzyme is not there, then chylomicron and VLDL will be accumulated in blood. So, both chylomicrons and VLDL increase, but increase in chylomicron is more than the increase in VLDL. That's why this disease name is hyperfamilial hyperchylomicronemia. You know, chylomicrons and VLDL contain which lipid? Triglyceride. So in this patient, triglyceride will be increased, but cholesterol will be normal, right? Also see type 1 again. In type 1, if ApoC2 is defective, ApoC2 is the activator of lipoprotein lipase. So if this activator is defective, then also enzyme is not working, and then also picture is same like type 1, right? Now coming to type 2A, type 2A LDL receptor is defective or ApoB100 is defective, because ApoB100 is the main ligand for LDL receptor, right? So now which lipoprotein will increase? LDL will increase, because the receptor is defective on liver. So LDL won't be taken up by liver cells and all the LDL remain in blood, leading to increased LDL levels in these patients. LDL contain which lipid? It contains cholesterol, so now only cholesterol will be increased, and this is known as familial hypercholesterolemia. The type 1 was chylomicronemia. This one is cholesterolemia, right? Then coming to type 2B, in type 2B the defect, we don't know the defect in these patients, that is unknown, but we have seen that in these patients both VLDL, LDL are increased. Because both VLDL, LDL are increased, that's why this is known as familial combined hyperlipoproteinemia, and here both triglycerides and cholesterol increase, because VLDL increase means triglyceride increase and LDL increase means cholesterol increase, so both will increase, right? Now the last type, type 3 is ApoE is defective. Now here in when ApoE is defective, which is responsible for the uptake of remnants, so both remnants, chylomicron remnant and VLDL remnant will increase, and both triglyceride cholesterol will increase, because remnants contain both things, and this is known as dis-beta lipoproteinemia or broad beta disease, right? So if you learn this table, then it is very easy to solve the questions on hyperlipoproteinemias. But one more thing is required when you are solving these questions. When they give you these questions, they don't directly tell you triglyceride increase or chylomicron increase. No, they will give you some clinical hint from the patient, and you yourself have to interpret that what that means, right? You yourself have to interpret. So see, some common clinical findings given in these questions are: if they write tendon xanthoma, means cholesterol is increased. If they write eruptive xanthoma, means triglyceride is increased. If they write Palmer and tuberoeruptive xanthoma, means chylomicron remnant and VLDL remnant is increased. If they write milky plasma means chylomicron is increased. And if in these questions they write acute pain abdomen, means they are going towards acute pancreatitis, and now that means triglyceride is increased, right? Because hypertriglyceridemia is the most predisposing factor for acute pancreatitis, right? This is it with this topic. Thanks for watching.